And we are live. So, good evening. Today, I have a very special guest for us here on Sports Chiropractic Chat Show. Man who maybe needs a slight introduction for the younger generation, but you know what? For the most sports chiros, he needs no introduction whatsoever. Mr. FICS himself, an absolute living legend. I'll give it to you, Dr. Brian Nook. Hello,
Hey,
Brian.
Mika.
How are you doing?
Good, Mika. Thank you. Thanks for the invitation to have a chat.
No problem. That's my pleasure. Well, tell you what, let me just quickly share my screen here. We'll get the rap sheets up. So we'll see exactly what's happening, you know, in terms of our respective bios and things. So we'll just, let me just move you around a little bit. There you go. So we just get the few bits and bobs there. But by the looks of it, you've been a chiropractor for quite a while now. Goodness me, 83 qualified.
Yeah, it was way before you even thought of.
No, I was firmly in diapers at that time.
Oh, that helped.
Well, you know, it's one of those things, man. You know, you obviously, I call you Mr. FICS or Uncle Brian or whatever, is man has many names, but you kind of been there since the beginning of the whole sports chiropractic movement, should we call it, and you've seen the good, the bad, the ugly, and everything in between, haven't you?
I had a few little runs around. I've had kind of got in just as it was getting started. I wasn't there at the inception of FICS, but was about 2 years behind that. But it was the guys that had the forethought of getting FICS and the ACA Sports Council and the different sports councils around and sports chiropractic. I was able to meet them and often was taught by them. And so it's what encouraged me to get involved more into sports chiropractic.
Yeah, awesome. So, I mean, just for sort of reference sake, you know, what made you become a chiropractor in the first place? What drew you in?
Well, like most of us, I beat the crap out of myself as a kid, playing football. My mom thought that I was trying to experience every known injury that a person could have playing sport. But I never sprained an ankle, so that part was pretty good. But yeah, tore knees.
Outlier in that.
Yeah, I am an oddball there. You know, separated shoulders, broken ribs, dislocated thumbs. I've had 10 knee surgeries, got 2 new ones. Yeah,
there you go.
Yeah.
Well, you got your money's worth in a way.
That's it. Yeah, and surgery on my neck. And so, yeah, playing sports. I was, though, taken care of mostly by an American-trained osteopathic surgeon. Both husband and wife in a small town in Iowa where I was growing up, neighboring town. But the husband was a son of a chiropractor. And
Okay.
both of them, though, were strong manipulators, very good in manipulation. And so I grew up being manipulated, but from their line, not so much a chiropractor. And so I was going into pre-med, planning on going into osteopathy, and then kind of made a little detour over into chiro. And then it kind of just went from there.
Oh, well, there you go. Do you know, we kind of have a similar onset or background as it goes. You know, my sports were football, soccer, and then ice hockey. So very much a done thing in Finland. And, you know, a couple of, 3 seasons on the trot, blew up my shoulders, right one twice, left one once, that kind of thing. And then I still went back for more, but the coach kind of said, look, son, you know, you had your shot. You know, so I didn't know what to do at that point. And kind of one thing led to another. And this chiropractor locally, he one day he just rang me up. I had been to see him before for a little bit of a chat, you know, that kind of thing. He said, so this is how we talk, by the way. So he didn't say, how are you? He just, as I picked up, he says, what are you doing in September?
Yep.
I said, hello. And I thought, well, I suppose I should go and study something. So I think I was in the middle of my national service at the time. And so he goes, yeah, what are you doing in September? Yeah. Okay, that's great. You know, have you got a passport? Is it valid? Yeah, it's valid. Yeah, we're good. All right, brilliant. Yep, I've sent your application and you're going to study chiropractic in Bournemouth. Get there on the 16th of September. That's when the term starts. So go. Click.
I like the way he goes. You should do more of that.
Yeah, I totally fell into it myself as it goes. But, you know, like yourself, I think I could, the reason why sports chiro is so near to my heart is because I can sympathize with everybody when they come in. Because I've experienced every injury known to man.
That's it, exactly. And I do think that, not that I'm encouraging young people to go out and do it, but you do have a relationship, even though it's not exactly the same. When somebody says, hey, my knee hurts like this, after replacing both of mine and all that I went through beforehand, I've got at least something to relate to.
Oh, yeah.
You know, it gives you that connection to where you can talk to them and go through what they're going through and be able to get that connection. Because we know with chiropractic, and especially sports chiropractic, we get a brief moment in time to get a connection with somebody to help them emotionally, psychologically, physically. And we know that one of the big effects that we have is that connection that we get. And the advantage we got is we got these guys that we actually touch them and we do things with them to get that connection back to them.
Oh, absolutely right. And it's that kind of, you know, it's that empathetic, you know, what do you want, whatever word is appropriate, you know, grammatically, I don't even know. But it's that empathic connection, like you said, you know, it's, you're, you know, we're one of the good guys, right? We're on their side, we're trying to help. And if we're able to, you know, have even the briefest glimpse of having been there ourselves, you know, it goes a long way, I think.
Yeah, it certainly does. I think
Absolutely.
for sure. And there's a lot more of that that's coming out, and especially in the research and everything else, is that what we say, how we say it, what we do has such a critical factor on the clinical outcomes with that patient. And they're now classifying it into what's called non-academic characteristics or traits.
Oh, yeah.
And well, that's one of the things I'm kind of researching here is how do we actually teach chiros to really be able to connect on a way. And touch is one of those, but we've got to have that communication skills. We've got to have that ability to relate. We've got to have that empathy. We've got to have that altruistic types of values and characteristics that really drive home that. And with athletes, I think that's really important.
Oh, absolutely.
Because you get a free time.
I'm sure you've seen this again numerous times, you know, during your career. But patients come in and they say, "Oh, I had an injury 15 years ago, and the doctor said that you'd be able to go for 10, 15 years and you'd be busted."
Yep.
And how many times have you seen that self-fulfilling prophecy come through? You know, it's crazy, isn't it?
Yeah, it is. Yeah, exactly.
Almost to the date, you know, this one lady, which I remember, she's like, must have been in her mid-60s, like ex-Olympic rower or something like that. And done herself lots of mischief, you know, that kind of thing. And then she said she had to have surgery, and the surgeon apparently said that 30 years from now, you're going to be, you know, in a bad way. And she quoted this date of the person saying that it was a week out to 30 years.
Oh. No, don't plant that seed.
Yeah, I know. But
in fact, there's some articles that have actually come across that say that's exactly why we've got to be careful what we say.
Yeah, what if, you know, flip that coin on the other way? Yeah. What if that surgeon was said, right, now with this care, with this, you know, if you look after yourself, you do these things right, you look after his nutrition, your recovery, your training, and you're going to be absolutely fine forever.
Yeah, you might have some aches and pains. So will I.
Yeah,
but
everybody
let's run this thing as long as you possibly can.
Yeah, absolutely.
You know, it's kind of like I relate it to the cars that most of us drove when we went to chiropractic school. We knew at that time there was no way that car had to last for as long as we possibly could. I mean, we drove the tires off of it. We put new tires on. We kept and we get in every morning when it was minus 30 back in Minnesota and hope that it would start, because we knew it had to keep going. Or that's what we got to do with these people too. Say, listen, it may not look great. It may have some dings and bangs and everything else, but you know, run the thing because it's the only one you got.
Yeah, exactly right. Exactly right. And I mean, you know, playing it safe is probably the most dangerous thing in the world, isn't it?
Yeah.
You know, if you stick to your comfort zone, that little sliver of, where you don't strain yourself, and you do that all day, every day for 20, 30 years, then you're going to end up being that person who complains about not being able to do what they used to do.
Exactly.
And it's heartbreaking, right, isn't it?
Yeah, it is. It is. It's kind of an interesting aspect because when you're going through chiropractic school, you're so focused on developing those diagnostic skills and learning how to read films and pathologies and then developing your clinical skills and your adjusting skills and everything else, and then turning that into a business and being able to run a business and everything else, that some of these other attributes just kind of get thrown to the wayside. And somebody that's been in academia for a while, you'd watch and you'd see some of those graduates that you knew were really switched on, knew their diagnostic skills, their clinical skills were fantastic, and then they don't do so well out in practice. And then you got that other little goofball that, maybe wasn't quite as up to the snuff as everybody else, and just goes out and smashes it. And you just go, hang on a minute, what's going on here? But the biggest thing is how they relate to patients.
That's right. It's the difference between a pedigree and a lovable stray, isn't it, almost?
I kind of know the lovable stray.
Oh, yeah, been there. I firmly associate myself as one of those.
Exactly.
Total oddity as it goes, but that's all good, man. If you kind of stick to your guns, and actually just are comfortable enough to be yourself instead of hiding behind all the clinical stuff, the mumbo jumbo, the big words and things that are supposed to inflate your ego rather than anything more. Yep. Patients kind of see that, athletes sniff through that quicker than anything.
Yeah, well, a lot, absolutely. You can't pull it. I treated one individual, you just reminded me of it, and he's very well known and so on. And as I walked in, he goes, Brian, I hope you can help me. He's actually referred to me by one of my graduates and students. And I had one time to treat him because he was from overseas. He was just happened to be in Sydney at the time. And so I came in and I treated him and did a lot of functional different stuff with him and functional adjusting and so on. And he was really into movement. He understood movement and so on. And he said, Brian, we got all done. And I said, well, do you have any questions? And he says, I've been treated, and he started to list a lot of chiros I know that are very well known. And he says, I got a BS-ometer that's pretty sensitive. And he says, I know when somebody's trying to pull the wool over my eyes. And he didn't lead on to that at all. But I was being judged so much by everything I did at that time. And you know what? That's the way it should be. Yeah. And athletes do that a lot. Athletes are extremely critical.
Oh, absolutely. And I think, in all honesty, if we turn that again slightly differently, but I always think that there's a therapist for everybody. There's the right person for every athlete, every patient. Yep. I may not be that person.
Yeah.
And that's cool. I am totally happy not being that guy. They've done me the honor to come and check me out and see what I do. If it's not for them, that's cool.
Yeah. Well, one of the things I tell the students here is that it's very easy, and it's not just chiros, but we do a really good job of making patients fit what we do.
Yeah.
Why? Well, let's turn it around. Let's adjust what we do to fit that patient. And then if that still isn't that, then let's find the next person that's perfect for. And let's get them off to that fellow chiro. We don't refer enough amongst each other.
No, absolutely right. There's that weird mentality, I would say, that is that kind of scarcity, lack, competition. Actually, there is none of that. I don't think any of that exists.
No, I don't either. I really don't.
For everybody.
That's it. I always said that, we refer to them as my patients. Well, they aren't our patients. We're just fortunate enough to be the person providing the care. And I described to the students that, we're this best buds group when we're going through school. And then we all become arch enemy demigods out there in the reality of the realm in which we now put ourselves. And I says we establish this castle with a semi-permeable membrane that athletes patients can only come in, but they better never go out. If they jump the moat, cripes, more alligators. Let's get them in there. Let's keep them in. And that mentality's got to shift a little bit, more into, hey guys, if I can help you, let's do that. And I was fortunate in Northwest Iowa when I was practicing there. I had a group of people that we all understood what we were trying to do, and we all respected each other. And I had a gal that practiced about 30 miles south of me, and if I had a neck that just, I knew I could move it, but for some reason it wasn't moving the way I wanted to, I said, listen, go down and see Doris. Doris will sort you out. And Doris would treat her 2 or 3 times and say, right, get back to Brian. He'll fix it up the rest of it. It's kind of like the pickle jar at Christmas. You just got to get that thing loose and then you can win. And it was just that collaboration was so cool to actually practice in. And that's one of the things that I think attracted me to FICS events. You got a group of people to where all that just goes out the window, and you're just there to treat athletes, and that you could call on somebody else to say, hey, show me how you're doing this. Can you help me with this athlete? And that camaraderie just gels.
Absolutely. You totally beat me to the punch there. I was going to bring that up next, which is the FICS games and events, and hence, I'm wearing my commemorative 2017 CSIT games hat. It was a brilliant event. But like you said, it's a labor camp. Let's face it. You're there to work. You rock up at the venue at whatever 9 o'clock in the morning. You don't stagger back to the hotel until 6, 7 in the evening, and you don't take breaks. You just go. Yep. But it's not so much fun, isn't it?
Yeah.
This particular CSIT games, we went to Riga in Latvia, and so I was there with Tom Greenway and Renee Fischer so Tom is from UK, Renee from Denmark. And so we were assigned to the volleyball arena. And at first we thought, volleyball, really? Come on, man. Come on, give us something like a bit more interesting, like boxing or something where there's like real injuries and that. But actually, so we rocked up at this volleyball arena. We thought, right, 3 of us, we'll just bring 2 benches. I'm sure it's going to be fine. Somebody can be on a break and two treat, that kind of thing. So rocked up in there, set up the whole thing. And literally within 3 hours, we had a queue of 15 people. By the end of the first afternoon, or middle of first afternoon, we were on the phone going, Tim, can you send somebody? We're swamped over here. So at the busiest time, we got 9 chiros on 9 benches, and we still had 25 people. Sort of, the athletes were making a waiting area. So they just found like sofas and things. I don't know where they found those from, but they just literally, this whole place was absolutely swamped with people. And yeah, we were just sort of bumping hips, and, docs bashing into each other. And, somebody brings an athlete, with the ankle completely pointing the wrong way. And they just dump her on the bench there, go, all right, here you go, do something. What?
That's exactly right. It can be at times really quiet, and then opens up the opportunity to really chat with somebody from a different country that's doing exactly the same thing you are, and to learn what they learned, and it breaks down a lot of the stereotypes, and the knowledge that you gain out of that it's one of the best lab sessions that you can ever have. That's why I like bringing students to those. So I said, listen, this is going to be your intensive residency. You're going to camp out with these guys, and you're going to pick everything you can up from them. And then there's those smash times, but it's what you get exposed to that's so much different than your office. But I've got to ask you, Mika, as a younger man, still early in practice, getting things going and everything else, why in the world would you walk away from making money, paying your bills and everything else, pay your own money to go to some blooming event and work your butt off treating these guys and get paid absolutely nothing? What would ever even encourage you to do something like that?
Well, I question my sanity at times.
Good.
I give you that, and so does my lovely wife, and just about everybody I know, but that's beside the point. Now, the reason why I go is because I just like it. I mean, I can't really give
Yeah,
you
but
any.
tell me more about it. What do you like? What did you come home and go, that's what I got out of this?
Do you know what, Brian? I came back buzzing. It was like I was just tingly all over. Literally, I mean, on the plane back, I was flying back and in a taxi on my way home. It was just that kind of, wow, let me at him. I can't wait for Monday clinic. Get back in there. Throw a few stories and just adjust and apply all these different things I learned. And it was brilliant.
Yeah.
And came back with a whole bunch of good new mates as it goes. Good friends who I still keep in touch with now. And it's that kind of thing where it's giving back to the profession a bit, giving back to community, and just having a hell of a nice time. Yeah. Albeit a labor camp that I paid to attend. I still have my clinic overheads running and all of that kind of thing. But hey, look, you know what? I enjoyed it. And that's the most important thing. That's what matters.
Yep. And so the next question is, so you've been once.
Yeah.
Would you do it again?
Oh, hell yeah.
But why?
For the same reason.
Same reason. So in other words, you're hooked. You're addicted.
Yeah. Oh yeah, totally.
And Mika, that's, we're here to talk about, FICS and sport and chiro and everything else. That's what got me hooked too.
Yeah, I bet.
Same type of thing. And that's why I've been doing it all this time. It's but it changed after I got to go to my Olympics. I had a revelation and it came from watching somebody else that had been at the Barcelona Olympics with me with another country. And what I saw was that person had been there. This was now their second or third Olympics. And they kept talking about how they had to secure their spot.
Okay.
And all of a sudden I went, this is not my spot. This is my profession's spot. And it's now I've had my Olympics. How about if I get more people to have their Olympics? More people to get the Olympics and more people. And so most of what I'm trying to do now is work in the administrative realm to open up those opportunities, because my experience was so earth-shattering for a pedunk kid coming from Pedunk, Iowa, that grew up working on a pig farm, to get to that point. It's like, listen, everybody should have that opportunity. Everybody should have that chance to go and experience that, and that the athletes deserve. And that's why I like FICS's vision statement that seriously, we want every athlete to have a right of getting sports chiropractic. But it's going to take that work collectively to open those doors and keep them open. That's the next thing.
That's right. And do you know what? Nobody does it better than you, my friend. That's the thing is, you're obviously in university life. You're bringing up and rearing the next generation or generations of the eager kids who are coming through, and they're going to be obviously then stepping into these shoes and hopefully with absolute stellar skill sets and mentality and the right mindset. So we owe you a massive depth of gratitude, for doing there and doing what you do, and obviously for taking this time to have a chat with me this evening. I hope that at least a few of your students and students around the world will get to see this.
Well, I feel I still am paying off my debt. I do it because I had people before me that opened the door for me. The guys like, Daniele Bertamini, our past president of FICS, the Noel Pattersons, the David Pearsons, the Stephen Press, these guys that Roland Noyer, who opened the opportunity for us. I mean, we wouldn't have the World Games if it wasn't for Daniele Bertamini getting that contract with Ron Froelich. Tom Greenway was there when the paper was actually signed, and that's a standing agreement that we've been able to do for the last 4 events for over 16 years.
Yeah.
Doing that. And I remember going because Daniele then turned to me and said, right, Brian, put the team together, get over there. And Ron Froelich, when he signed the contract, because we had to beg him to let us go in, he said, right, guys, I'll let you come to the World Games, but you screw this up, you'll never work in sport again. And so then Daniele said, right, Brian, don't screw it up. Get over there, get it to work. And Tom Greenway was with me with that one there, Alex Steinbrenner, and a great team of people in Germany. And it just then has snowballed from there. And the nice part is, once we get the opportunity to do what we do, we're done.
I mean, the athletes love us.
Yeah.
I mean,
it sells itself.
They love us. You know, there is no other way of putting it. You know, no other profession, I think. Oh, I mean, okay, I can't speak for the osteopaths. You know, in all honesty, I don't know what they do that well. Yeah. But with no other therapy modality, do you get that instant relief?
Yeah.
Or the instant result?
Yeah, results. We get that quick activity to where they can then go back onto the field. They can do what they need to do, and we can see that result so much quicker. I'm so fortunate that I didn't go in. If I'd gone into pre-med and gone into osteopathy, I probably would have ended up either as an orthopedic surgeon or as an ER doc, because I like that urgency, that on-field type, oh my God, what am I going to do with this? That adrenaline rush that I think comes from sport and so on. But I wouldn't be able to see or have lived in different places in the world, traveled as much as I did, especially, again, coming from a little town of 1,600 in northwest part of Iowa. I never would have gotten to meet the people and everything else if I'd probably had done that versus what I was able to do here. My kids would not be doing what they're doing now.
There you go.
We had very successful practices in this small little town, 2 practices, busy as anything. But what it's done for my family and everything else, and those guys gave me that opportunity. Yeah, I had to walk through that door of opportunity, but they're the ones that showed me the door and showed me that it was open.
No, absolutely right. But I mean, coming back to the whole sort of ER doc, and how is that kind of similar in a way to sports chiro? But you know, sometimes when you're at the warm-up track, you know, at the World Games or the Olympics, and you get a very well-known athlete rock up to you and go, Doc, my heat is in 20 minutes. My ankle is hurting. Can you sort it?
Yep.
What do? You got 2 minutes.
Yep.
Sort out that ankle and get that guy performing so he can win his heat and then get into the final, isn't it?
Well, we've got one, and there's some very incriminating pictures that one of our Martin Isaacson's got of me. But we were working at the World Games at the finals of dance sport, and so here is these unbelievably made up dancers out there dancing standard, jazz, everything else, and these people are athletes, unbelievably built. Worked with them quite a bit. Well, we were actually the venue. We're in Columbia, Cali, Columbia. And the venue for the dance sport was the outdoor bullfighting ring.
Nice.
So it's where they have the bullfights. They cleared it. They put the floor, and we're right next to the floor. And so I'm working on somebody else there, and all of a sudden my wife taps me on my shoulder and says, Brian, one of the dancers just went down. And one of my other guys got quite excited and wanted to run out on the court. Well, I told him, listen, that's not our domain. We're here onto the side. We're in the warm-up area. That's the locals. So I went over to the sports director for the whole tournament, which I know pretty well. I just stood there, and he looked over, and he nodded to me, and I stood my position and stayed in my zone, stayed in my lane. And then he went out, got her, brought her back, and just called for me as he's coming off the floor. Brian, come over. There's a dancer from a Middle East country. And what had happened is, in standard, you know, they got their arms up like this, but they're moving across the court. One of the other dancers with his elbow had hit her right up in the upper trap. Wow. And it was so painful, she just collapsed.
Mm.
And so we went over, and now she can't turn her head. And of course, with dance, she's got to be able to turn her head this way. She can't turn her head. She can't bring her arm up. And,
Yeah.
and I said, okay, let's see if we can work on you. She'd never been treated by a chiropractor, never had an adjustment, nothing like that. And I said, okay, let me see what I can do. I said, when do you got to dance? She said, I'm on in a minute and a half. I go, okay, let's see what we can do. So I'd work on her. I said, okay, can you do this? Got her doing the functional movement, did whatever everybody else would do, did what we could, and said, okay, can you move? Yep. Can you dance? Yep. Show me how you can do this? Yep. Okay, go back out. She could return.
There you
I
go.
said, as soon as you're done, come back again. And it's heats like this. So
Yeah,
sure enough, she gets done. She comes running off, and she goes, right, I got 30 seconds. Back and forth. We just kept going until she continued her, and she ended up like 6th place, but she was able to compete. I saw her the next day, and she said, hey, this is, thank you for everything you did. And she was very happy. She said, I would not have even been able to get as far as I did if I hadn't had some type of care. And that wasn't anything that I did. It's what any of you would have done too. It's just that we were there, but the juice, the excitement, the ability to be able to jump right in and do something like that, that's what gets you hooked.
Oh, absolutely. I mean, we had a similar kind of thing, you know, at the volleyball arena at the finals. So last match of the tournament, right? So I've been treating the both teams of the final all the way through from day one, you know. And so we're kind of sat in the bleachers, you know, the whole lot of us here, you know, all the chiros are sitting there and enjoying the, you know, putting the legs up, feet up a little bit. And we had cleared away the benches and all the kit. So thinking, you know, nothing else can go wrong, right? Anyway, so they're doing their warm-ups, and all of a sudden his shout goes out. I turn around, and there's one of my lads is on his face in the floor. And I'm thinking, oh my goodness, here we go. So me and my mate Juliet, we just jumped over the bleachers. So like 4 or 5 rows. I don't even know how that happened, but, you know, got there onto the floor next to this guy. I'm holding his head, you know, she's assessing damage. You know, there's a big gash on his face, you know, blood everywhere. And we have 4 minutes until, and this is their star spiker. So the guy who smashes the bloody ball to the court. So they're not going to be able to really play without him. They didn't have, I think they had 1 sub or 2 subs. So it was that kind of thing. So, so we end up just sort of kinesio taping his chin together. It was very much the same shape as my beard as it goes.
There you go.
Bright pink. That's all we had.
Why's your spiker smiling all the time? Oh no, that's kinesio tape.
Yeah, it was just like this massive strap of kinesio tape. And I mean, the ref came and had a look, you know, and he just said, right, any bleeding? No, yep, here we go and play. And we had to replace his stuff, you know, at halftime or whatever. But, you know, the point is, Papa Smurf managed to play, and that was good.
and I don't remember getting taught chin bleeds usage for kinesio tape when I took my kinesio tape course.
No, I think, you know what, we might have improvised a little bit.
But that's actually my point is that that's the type of stuff that you oftentimes learn at events like that too, because you're put in those situations to where all of a sudden you got to go, right, what do I know and what can I apply, because I got to get something done here. And
yeah, what equipment have I got?
Yeah.
And I mean, that's where also maybe the military first aid stuff comes in handy, you know, and so you just have to apply some kind of pressure and sling it around the head a little bit. Good to go. It looks ugly, but go for it.
Well, we had one that this was years ago. This was 1990. Would have been 1990. Yeah, it was the All African Track and Field Championships in Cairo, Egypt. And I was working beside under the tree right outside of the stadium. And a guy who's now a president of a chiropractic institution was working next to me. And I'm working on my athlete, and John yelled over and said, Brian, when you're done, can you come over and help me with this foot? I said, yeah, sure. So I went over there and he says, tell me what you think. And this is another beauty thing that oftentimes we don't get to do in our practice. You get to see other people work and learn from each other. And so I said, okay, so I assessed it and I said, right, my conclusion is I'm highly suspicious she's got a Jones's fracture to the base of her fifth metatarsal on her right foot. He goes, that's what I think too. And I said, okay, well, what do you want to do? And he said, well, she's a javelin thrower, and it happens to be her plant foot when she follows through.
Yeah.
In fact, that's how she injured it. We said, okay. So we called the coach over. She doesn't speak much English. And we go, right, explained it all to him. And he sits there and listens so quietly, courteously. And he goes, yeah, she throws in 45 minutes. And so we told him again. Of course, we spoke louder because obviously he didn't hear us. And went all through it again. He goes, yeah, no, guys, I heard you the first time. She throws in 45 minutes. And we go, don't you understand? He said, no, you don't understand. Right now, she's in fourth place. If she medals, she's got a full ride scholarship to a university in the UK. If she doesn't throw, she doesn't medal. She will go back to tending goats in her village back in Africa. And I turned to John and said, right, how'd they teach you how to strap up a Jones's fracture in order for him to throw javelin? He goes, oh, I never got taught that. How'd they teach you? I didn't teach me either, but we're going to figure it out right now. So we sat there and we go, right, it's a stable fracture. We just got to offload. And this was before we had all the fancy tapes we got now. So we went through and we worked out what we could, have her test it, come back, add a little bit more, change it a little bit, got it to where she worked. And when she walked out or ran out of the stadium and put her bronze medal over our necks and lifted both of us up at the same time, which she could do, we went, right. Now, I didn't get her that bronze medal. We were just fortunate enough to be there. She got there. That was her work, her tenacity and everything else. But it's kind of cool to be a bit a part of it. And that also helps you.
You get that much of it, isn't it? I reckon I reckon a little corner piece is yours, you know.
Well, in fact, more importantly to me is not that medal, is the fact that was a life-changing moment for her.
That's right.
She's got a chance for a full ride scholarship. And that's probably, being in this game as long as some of us have, that's probably one of the things that you don't get to hear that end of the story. It's like going through half the movie, getting through a really emotional point, missing act 2. You just, you don't get to get that. So once in a while you do, you get to follow up and meet these guys again. It's really cool, but other times you just don't. So.
No, absolutely. But yeah, you know, it is so satisfying. And even in your own like daily practice and that, you know, you get these stories of athletes or even just normal patients, you know, who are, you just pull something that little bit extra special out of the bag just because.
Yeah, that's right. Yeah, it's what we do. It's what we have to do. And that's no different than a surgeon that's in the middle of a surgery and all of a sudden goes, well, and I had a great instructor back in chiropractic school because I was complaining to him about how do I get this all wrapped up in my head and everything. He says, Brian, I'm going to tell you the secret that I learned, but he goes, you have to promise me that you'll do it in this exact order or I won't tell you. Yeah, I promise. He says, you're lying to me already. And I said, okay, well, what is it? He says, Brian, you got to buy the book, you got to read the book, you got to learn the book, then you got to throw the stupid book away. And I go, okay, yeah, I can do that. And he says, no, you're already to number 4.
Yeah.
You skipped 3, 1, 2, and 3, and went right to 4. I go, well, yeah, maybe. But that's so true. A lot of our patients, they didn't read the book. And
Exactly.
And that's what we have to teach students. Listen, we're only teaching you enough to develop a foundation for you to then learn more from. And that's, again, why sports chiropractic is a really fast educational tool. Teaches you a lot of stuff. I've been fortunate enough to work at the Valor Games here in California, and we have a lot of our students out in the Veterans Administration and the Department of Defense clinics, and what they get exposed to, the injuries, the challenges that these people are going through, the altered anatomy, and getting function back in something that is altered anatomy is just a really unique experience, different than an elite athlete.
No, that's right. Absolutely. And, you know, I mean, a patient comes to mind just recently, you know, I saw this fella, he's a builder and, you know, not exactly an athlete, you know, carries a bit of extra weight and all excess weight and that kind of thing. But, you know, the point is he had a motorbike accident sort of 15 years ago, 20 years ago. And as a result, his talus on his right foot or right ankle was fused into his tibia.
Yep.
Which left his ankle in an angle like that. So he's always on his tippy toes on one side.
Yep.
Now, I haven't actually seen the x-rays yet. He's such a recent new patient, but he forgot to bring them. But I mean, I've tested it in whatever way I can, and there's minimal to no movement. He says it's completely fused. That's what his doctors told him.
Yep.
So he had been to see somebody else before who put a wedge of about that much under his heel, just to kind of accommodate for that ankle being in a funny position.
Sure.
And he kept him going. Don't get me wrong. He was okay. He was able to function and he was able to look after his kids and do his work and that. But now all of a sudden he's got a back problem. So I looked at him as he was stood up, his kind of pelvis is a little bit this way and his spine goes a bit that way and it's a bit sort of wonky all over the place. And I said, you know what? You're not going to like me when I tell you this, but we might have to put a little bit something under the other foot.
You need stilettos.
No, you know what? I mean, well, the point is, as soon as I put a book under his foot, I made him stand up, so under his left foot, I put a book under his foot. All of a sudden, pelvis goes, shoulder square up, spine goes up. He goes, I said, so can you bend forward? Touch his toes, comes back up. He goes, wow, you're a magician. I said, no. No, sorry, that ain't me.
Exactly. Well, I had that after they got my knees replaced. I was going through my rehab and working hard at it and everything else, but my feet just killed me. And I couldn't get over why my feet hurt so bad. Now, they took 15 degrees out of both knees. I mean, I looked like John Wayne on a bad day before they did it, and they straightened them all out. And so I was really happy. My knees were working good. They functioned real well. But geez, my feet, what is wrong with my feet? And in hindsight, I go, oh, geez, Brian, you should know better than this. And so finally, I turned to my wife and I said, listen, I'm going to go buy a different pair of shoes. And she goes, well, let's just get you. I said, no, let me just get one pair of shoes. So I went out and I bought a different pair of shoes, put them in, boom, all the difference in the world. Why? All my shoes that were in were used to me exactly doing this. And afterwards you just go, well, geez, Brian, duh. But my orthopedic surgeon didn't tell me that. My physical therapist didn't tell me that. And I didn't tell me. I had to experience it myself before I just went, okay, this just makes sense. And a lot of it is common sense.
Absolutely. And it was like one of those jobbies. I remember one of our instructors back in the day in ACC. So this guy taught extremity adjusting and all this kind of stuff, and Gonstead and all this kind of, so all the good fun stuff. So one day he's doing this. We're in class and he's doing this demonstration on somebody's ankle or foot or whatever, and somebody says, "Oh, Doc, what are you adjusting?" I don't know. What do you mean you don't know? Well, it kind of looks like this or it looks like that. So, so I'm not sure. So he goes, what do you mean? Surely you must know, come on, you're like the doc, you should know. What are you going to do about it? Well, I could try this or I could try that, but I don't think that's going to work. So I'm just going to make something up.
Exactly.
And it was like brutal honesty, at that point. I thought, you know what, well, I mean, come on, that's what we do in clinic all the time anyways.
We do. Well, first of all, the clinical experience is an experiment. We take all the knowledge and the tools and what we've got and we apply what's best to it. Healthcare is an experiment. Yeah. You go in, you got these set of symptoms here, take this medicine or try this surgery or whatever it is, and then let's see if it works. If you've got some sort of infection, you use what the typical broad spectrum antibiotic it is. If it doesn't work, you're back there in 5 to 10 days going, and then they may do culture sensitivities and so on. It's all an experiment. The old show House was a beautiful example of that, of how experiments usually don't work well and everybody's going to have kidney failure at one point, and then finally he gets the miraculous cure. But that's what we do. We assess to the best of our abilities are. We diagnose the best of abilities we are. We then apply a treatment regime that along with them, we then monitor all the time to adjust to get that person to the best of their peak performance that they can get to. And I was picking up of watching you and Daniel's conversation last time on this is that, you know, the difference between your run-of-the-mill type patients and athletes. And I practiced in Iowa with very much farmers and people that were hardworking individuals. My practice in Western Australia was very much a similar type of guys working on mines and this type of thing. And in my mind, I found that, quite honestly, they're athletes too.
Mm. Just
they have to be able to perform, and they want to come in and yeah, they may only want to get to a certain performance level versus an elite athlete that has to be able to perform at this level. Their priorities are different, but really what I do is the same. It's
yeah, absolutely. I mean, what's the glaring difference though is in the recovery, is in the aftercare, isn't it?
Yeah,
because
absolutely.
no athlete has a pretty cushy life if you think about it. When they're injured, their job is to heal.
Yeah.
Right? Whereas you have a miner or a farmer or a builder, man, they got to put the bread on the table. They're going to be out there busting their chops for 10 hours a day. And then they got to get home, look after the kids because the wife is tired. And, you know, then they have to go and walk the dog, you know, even if their, you know, knee is hanging off or whatever. They still got to do it. And they still somehow have to heal in all of that. So, yeah, I mean, I think, you know, these guys with real jobs, you know, they have a lot tougher time in a way.
That's one of the things that you're exactly right. They don't get that time to really recuperate, and that's why they're harder for us actually to a lot of times treat.
That's
because
right.
you know you're never going to win, and they also don't have that set time to really get the recovery and do the rehab and everything else. I had farmers that said, Brian, just patch me up. I got to get in the combine today. Yeah, just get it so I can they're going to take me in a loader bucket, raise me up, and I'm going to walk in and I'm going to work all day. Just get me inside that cab. That's all I got to be able to do. It's like, okay.
Yeah, thanks.
Yeah. Yeah, exactly. Let me pick up that piece over there and that piece over there. Let's see what we can do.
Did you bring any duct tape with you by any chance? You know?
Duct tape and Gorilla Glue. We're all set.
A few zip ties as well. You know, it always goes down well, doesn't it?
That's right. Well, and with my wife being a veterinary surgeon and doing large animal, small animal surgery, and now she does all manipulation, to see what she has to do with those animals and stuff. And a lot of times it's similar type of stuff. You know, I'd help her with surgeries and everything else, and you see that they've got to work in a similar way, that they take that baseline knowledge, they apply it to what they can do best for that person or that animal at that time, and then hope that everything works out. And sometimes it does. And at least we don't have the deaths and the crisis care that they go through or our medical colleagues go through. We're very fortunate with that.
Oh, absolutely. Absolutely right. But yeah, you know, it comes to, I was thinking about this the other day, you know, it's like you said earlier, you know, the patients haven't read the book. It's, you know, the college and the education we have, it gives us the generic blueprint, isn't it? Yeah. And then even if you're a builder, you kind of understand, you know, a house has a foundation, it's got some walls and a roof and a chimney and maybe some electrics and throw a radiator or two, that kind of thing. There's a house.
That's right.
Well, I mean, that describes, in a way, every house, but it doesn't describe any house.
No.
And it's the same with us, you know, human beings, because everyone is just blinking different.
Yeah. Yeah, I'll take your analogy. We give you the house, but it's up to you to make it a home. You've got to add your own flair to it. You've got to decorate it. You got to bring the furniture in. You got to bring the kids and everything and the animals all into that. That's what makes it a home. And same way with what we try to do. And that only comes from that experience.
Yeah.
Getting out there and then testing it and correcting and improving. And the more varied experience you can get, the more you get to polish what it is that you're actually trying to do.
And it takes a long time actually to understand what is it that you're trying to achieve, doesn't it? Because in all honesty, you know, I mean, I qualified in 2007, and I think like literally like the last few years, I kind of figured out what it is that I'm trying to do, what is that I'm trying to achieve. And funny enough, when that light bulb kind of went on, you know, ding, all of a sudden, a lot of the sort of external stuff just fell away. You know, it was that kind of moment that when my eyes just popped open, I thought, he's actually quite simple.
Yeah. Don't overcook it.
No, exactly. Keep it simple. And just like I say to patients nowadays, you know, my job is to restore factory settings.
I like that. Hit the reset.
Yeah, we're trying to restore factory settings and allow that brain and allow that body to heal and function in as normal and harmonious a fashion as possible.
Yeah. And the challenge is finding that doggone reset switch.
Yeah, absolutely.
That's the challenge. Is where the heck is that hidden?
Yeah, and the other challenge, of course, I mean, you got a number of different ways you can get to that reset switch. You know, you can follow various different like protocols or techniques and whatever you like, right?
Yeah.
It always gives you something. Yeah. But then how do you communicate that to the patient again, which comes back to our original thing from earlier on. You know, we said like we need to be able to be empathic, and we need to be able to create that connection very quickly. Yeah. That establishes that, you know, okay, I'm on your side. I'm not trying to just take you for all you got. Yeah. I'm trying to help you, and I know what I'm doing.
Yeah. It basically develops that trust where they'll get in the car with you and start on the journey.
Yeah, exactly.
Otherwise, they're not even going to even open the door.
No,
it's like the Lyft or Uber driver that pulled up and you just go, okay, well, I'll get the next one. We just want to get them in, and we then start driving together on this journey of getting them reset, getting them onto aspiring to their goals. And we're fortunate enough that they chose us in order to try and do that. And with athletes, it's the same type of thing.
Absolutely right.
Absolutely. And then put that in a sporting environment where you've got, you know, 30,000 people cheering and dancing and everything else as you're going around. I mean, God, what a great living room. What a great office.
Ain't nothing better.
Exactly right.
Better. You know, that's worth a week of my time anytime.
Well, it is. I mean, a lot of people have asked me, it says, you know, Brian, how did you go away for 3 weeks to go to the Olympics? And what about your practices? And you had 2 practices and everything else. And I said, well, and please don't take this wrong, but, you know, my wife can work, but, and she was, brave. And believe me, she was. But yeah, I had some associates there. But the first time I went for the Olympics, I didn't have any associates. I just shut the door. And what I found is that once everybody knew that I was going to the Olympics, I was so much busier than I had been before.
Yeah.
And then when I shut down, I had no income. But when I came back, they were sick. I was exhausted. And I went back and looked at it, and I actually had no financial loss. And in fact, I had a gain.
Yeah, there you go.
So I deduced from that, incorrectly or correctly, what the reason my practice hadn't been growing before that was I needed to leave. I was the problem. And I talked to some of my patients about that, and they said, Brian, we get used to you being here. We know you're there. We know we can come whenever we need to, but we don't. Yeah, so now when all of a sudden it's a panic, that's right. And then one of them said something very astute to me. They said, listen, if you were gone just off golfing or sitting on the beach, now if you go to your family, that's fine. But if you were just off goofing off, in their words, that wouldn't have had near the impact. But the fact that we know that you're going out and doing something like this, more on you, good on you.
Well, it's respect, isn't it? You know, you're doing stuff that is worthwhile, and it's noble, and essentially shows whatever character, moral grit, you know, all this kind of stuff. Yeah, of course it's going to count in your favor, I would say. Yeah,
and it reflected into the practice. I've had some docs go, oh geez, you know, I'd like to go to that, but I don't know with my practice and everything else. And it's everybody's decision, 100%.
Oh, yeah, totally.
But if done correctly, a lot of times it doesn't impact that much. And what you gain out of it, isn't a monetary value.
No, absolutely. And I mean, in all honesty, when I kind of decided to pull the trigger and go for my stuff as well as my games and that, I thought, can I really afford to take the week off, and I thought, no, but I'll just do it anyways. And at the end of the day, it's for a new grad, it's even more scary. Because if you actually haven't got 2 pennies to rub together and you still have to pay the rent and whatever else, it is tough.
Yep.
It is a really difficult decision to make. But I don't know. All I can say is that, try and get out there as soon as, because it is so worth your while.
Well, I'd been out 5 years when I went on my very first FICS international trip. And I just bought my second practice. My wife and I graduated, started in practice in 1985. Most of you won't remember. Interest rate at that time was 19% and climbed to 23. And I had a business loan out with that. So I do understand. I didn't have the debt that our new graduates have now. I get that. But I had close to it because I had a wife through vet school and myself. And then to have those kind of interest rates. And yeah, my dad turned to me and go, "What are you doing? What is wrong with you?" And he eventually got used to me doing harebrained things like that. But what it actually did when I came back, it was my stepping stone to multiple more events that eventually got to the Olympics, which was an aspiration for me. And so I had to invest. When I went to Barcelona, I bought one of the nice polo shirts of Barcelona Olympics and everything else. And one day after several months, one Saturday I put it on. I come walking out, all kind of bristly and everything else. And my wife just turned to me and went, "Oh, there's that $40,000 shirt." Turn around and just took it off. I haven't worn it since. It's the seat chest, that's it. She knew exactly. I thought, okay, that's just too painful. I'm not going there.
It's a wifely thing, though, isn't it? They know exactly how to take the wind out of your sails, don't they?
Yeah, and we need that. We really do.
You don't get to let your head swell up too much,
It's good for them. They understand us totally. And our partners, male or female, that put up with the garbage that we put them through. And my family, talk about harebrained ideas. We were in practice, and then all of a sudden, through FICS, I got asked to go and teach in South Africa. And I remember it took us a while to get it organized, and we moved there for 2.5 years and had associates run our practices. And both my 2 practices and my wife's vet practice. And we knew this was a risk, and our accountant came to me. And what they paid me in a year to teach in South Africa, I was making in 3 weeks back in my practice. And my accountant came to me and said, "Brian, I have to ask you, have you thought this through? Financially, this is the stupidest thing you could absolutely do." And I go, "Yeah, I know that." And I remember sitting on the tarmac in the airplane with my little daughter next to me and my family in the airport and looking down at the ground in Iowa going, "What are you doing?" But what an opportunity and what a chance and what a life-changing experience it was, not only for me, but my family. But it was a big, stupid risk, but it was worth every penny of it.
Hey, you can't put a price on these things, that's the thing. In kind of similar vein, but when our second daughter was born, she was tiny, and we have no family here in the UK, neither myself or my wife, so we're kind of sitting here, it's buck stops here. We thought, what, are we going to be able to face the winter? UK winters are quite pathetic, nothing like proper winter, in all honesty, but it was that kind of thing. We had a 3-year-old and then obviously a few-month-old little tiny thing, so we thought, do you know what, the hell with it, we're going to go and bunk at grandpa and grandma's in Kuala Lumpur in Malaysia. That's where my wife is from.
Yep.
And we had 6 months sabbatical. Had associates run our clinic. I came back a couple of times to treat the hardcore patients who refused to see anybody else.
Yep.
It cost me an arm and a leg, and I loved it.
Yeah. Exactly.
I got to be a dad, you know, I got to do stuff,
Yeah.
enjoy my kids and all of that. And it was worth it.
Yeah, absolutely. It's a kind of a mantra that I have, and I've passed on with my kids is I say, guys, live your life with no regrets.
Yeah.
I said, now to qualify that is, you're going to make a ton of mistakes. Regrets are just mistakes that you decide to hold on to. If you go, right, that was a learning moment. Yep, I screwed up. That was a stupid move. Geez, I should have never moved there. Should have never done that. Okay, I've learned from that. I'm not going to do it again, but I don't regret the opportunity of learning that I shouldn't have done that.
That's right.
That's the next part. I said, just, go and live it. Do what you can do, because it's the only one we got, and just don't live without any regrets. We see too many people that are hold on to so much stuff that they don't get to enjoy what they actually get exposed to. They can't even express their feelings when it's right there in front of them. And
no, that's right. And I mean, for us as chiropractors, when it comes to sport as well, there are so many different opportunities in the world, to go and see the world and experience different cultures. And even if it's for a week at a time, at a labor camp somewhere in Latvia, come on, man, just do it. It is just brilliant.
Well, and everybody wants to go to kind of the run of the mills and everything else. And that's why I like the World Games, because you're working on the top athletes in the world. And like Daniel was saying, surf life saving, well, that's at the World Games. When he said that, I went, well, yeah, I know exactly what they're doing. But you also get exposed to sports that you're familiar with, like acro gymnastics. You were talking about that with your daughter. Phenomenal athletes. Rhythmic gymnastics, aerobic gymnastics, roller hockey instead of ice hockey. And so you get the top athletes in the world competing at that. And then you get to sports like fin swim, which I'd never been exposed to. Fin swim, it's like a whale fin and a big goggle and a snorkel right over their head and in a pool, and they swim like a dolphin and they do laps and they just scream across the pool.
I bet they're super fast, aren't they, with that fin?
Super fast with their fin. And then sumo wrestlers. I can remember first time Simon Lawson comes back and said, Brian, we treated this 200 kg sumo wrestler. And he's all excited. Yeah, we treated his neck. And I go, no. Where did you treat him? Well, at the sumo event. And I said, no. On what did you treat him? Well, one of our tables. I said, a portable table? I said, yeah. And I just went, he said, oh, yeah, it creaked a lot when he turned over. I'm like, oh, my goodness. It's those types of experiences where you get to expose to chook ball, which we'd never, cuff ball, at least the Europeans will know what cuff ball is. And those types of sports to where you're working on athletes, like we got exposed to speed climbing.
That's phenomenal, that is.
Phenomenal watch. And now it's going to the Olympics. So the World Games is now the staging ground for all disciplines and sports that are going to the Olympics. And when you come out of the Olympics, it comes down there. Rugby sevens was at the World Games. Now it's gone up to the Olympics. So you're just right in that perfect ground. And again, from an administrative, from a policy point of view, we as a profession got to show why we need to be there. We honestly don't deserve to be in some of the areas yet, because we're still new on the block, and they've got to check us out. And so getting involved with these events and showing why we're there, what we can do, and everything else is exactly what we do, so that we can then get our permanent place into these other events, other sports, Olympics, and so on, to where it's not just a one-time event. It's actually to where it's relegated, like with the World Games. Anytime that we have the athletes, you're part of the core services. We've got to be part of this event from that point on. That's what we're trying to aspire to, so that the battles get less as we go forward.
Yeah, a bit less resistance now. But hey, listen, this is something I'm sure everybody wants to know. Who's the most famous person you ever treated? If you're at liberty to say.
Can I say the most famous person I met, but I didn't.
Okay, no, yeah, cool. Yeah, we'll take that.
That event. It was at Cairo, Egypt. It was at the All African Games in 1991. We were at the boxing venue, treating boxers all beat up, treating them like crazy. And our guide came up and he tapped me on the shoulder and he goes, Brian, Muhammad's here. I'm like, yeah, they're everywhere. I said, seriously, that doesn't like that. I said, I just treated 5 of them. What are you talking about? He goes, no, Muhammad. And I go, yeah, I was busy. And he goes, do you want to meet him? And I'm like, oh, I don't know who you're talking about. And I go, Muhammad who? And he goes, Muhammad Ali. And I went, oh, hang on a minute. I said, no, I don't want to put you out. No, Brian, just give me a chance. And he comes back and says, come with me. And we had to go through 5 security lines. And the next thing I know, I'm standing face to face with Muhammad Ali.
Wow.
So this was back in 1991. So he was still in fairly good health and everything else. And he asked us why we were there. I took another chiropractor with me, Pat from Hawaii. And we got to chat with him. He says, what are we doing? We told him, hey, we're providing chiropractic service to the boxers. He says, you're taking care of my boxers. Thank you. Couldn't thank us enough. Chatting with him a little bit more. And then I said, well, we better leave you alone. We've got to get going too. He said, he stood up. Now he's on the bleachers, so I'm down here. He's up here. And he stands up. So he's like this mountain of a man in front of me. He gives Pat Arthur a kiss on her cheek. She swore she would never wash again. And I reached up my hand to shake his hand. And the next thing you know, he squares off and he gets in his stance. And I'm thinking, oh my goodness, what do I do? And the only thing I could think of was rope-a-dope. I just went like this. And he starts laughing like crazy. Hits me on the shoulder, about knocks me off, shakes my hand, and thanks us again, and off we went. And it's one of those cherished moments to where you get to meet somebody like that.
Oh, phenomenal, man.
Yeah, it's one of my favorites.
I think, you know what, you did the right thing with the rope-a-dope rather than punch him in the nads or anything like that.
So, yeah, I thought I get one shot. No. And politically, Cairo tries to hit Mom. Like, no, that's not going to work.
Yeah, you would have gone down in history as a real infamous person at that point.
That's right. Not on a good note either.
Yeah, exactly right. Oh, goodness me. No, there you go. You know, we appreciate your candor in that at the moment, as we call it. Good. Well, hey, listen, you know what, Brian, I think we're hitting our mark here. It's been an absolute pleasure having a chat with you this evening. It's been very enlightening for me as well, and giving the current situation with the lockdowns across the world and coronavirus doing all sorts of business, you know. So hopefully a lot of our listeners, viewers, you know, they take a little bit of find solace and serenity and a bit of I was going to say sensibility.
Not here.
Sanity, maybe not.
Maybe not.
At least a bit of entertainment for an hour or so, having listened to us jabber about sports chiropractic.
Yeah. So, no, it's my pleasure, and our thoughts are with all those people out there. I mean, we're all involved in this. We've never seen anything quite like this, but and maybe having some chats and talking about different things that we all do. We'll get our minds off it a little bit. Guys, we're going to get through this. We will come out the other side of it. We'll be better because of it. We're already seeing that. We're going to be more unified, closer knit, and everything else. And so it's one of those lessons that we're learning. But now it's time to just kind of, you know, be safe, be careful, watch out for each other, reach out to somebody that you haven't reached out to in a long time. Check on them and use this time to really reconnect so that when we're ready to go again, guys, we're ready to go.
Absolutely. And FICS, obviously, we are, you know, Dr. Christine Foss is putting together a beautiful new service, which includes all sorts of short courses, materials, of course, our flagship ICSC course is there for people to take and to get their ICSC qualification if you have the previous one, which is I can never remember the acronym, but it's very long. It's about 17 letters, I think. So get the head injury module done and you get your brand spanking new certificate there, and you'd be legit and legal to go to all of these FICS events and games and experience this for yourself. So guys and girls, you know, who are watching, listening, please take this opportunity. I think there's a little bit of financial incentive at the moment as well, which always goes a long way, you know, in easing the burden and making it just a little bit easier to pull the trigger. So go ahead, you know, check out the website, check out all the content there, and you know, I will leave you with that this evening. So thank you, Brian,
and I just encourage you guys to do that, and because Mika and I'd love to work at an event with one of you there in the future. I'm fortunate in working at events like that. I get to live 40 different docs experiences at an event rather than just mine. And that's just magnifies the whole experience itself. So I would really enjoy the opportunity to work with some of you guys at an event, and you guys invite me sometime to come to an event. It's just, it would be a lot of fun.
Absolutely. So we'll leave you all with that, and we'll tune in again next week for the next episode of Sports Chiro Chat. So we'll continue from there.
I think Mika's moment. I was thinking of a name for you. It could be FICS's Mika's moment.
I'm not sure how to take that, in all honesty, but
it's a good way. It's respectful.
It's a compliment. Yeah, we'll take it as a compliment. That's all good then.
FICS's Mika's moment. Perfect.
Oh, dear me. You know what? Goodness help us all, if it comes to that.
Well, good on you, Mika. Thank you for taking the gumption and the initiative to get this started. It is definitely getting out there. It's your insight into getting something like this that's enjoyable, that's fun, that hopefully people are getting something out of. I really appreciate the initiative and the drive to do it. And thank your family for taking the time. We didn't get the child coming in or the dog barking in the background this time. I don't know if you ran away. I hope not, but thank them also.
Mate, see, there's the clever application of duct tape.
Watch it; it'll be on you next.
every child and every dog should come with a complimentary roll of duct tape, I think.
Sounds good.
Yeah, just don't tell my wife I said that.
No, not at all.
Good stuff, Brian. Right. Well, we'll leave it at that, and we shall come back next week with an all-new episode. Okay. All right. See you then.
Thanks again. Cheers. Bye now.